thought of.
I am starting the live stream. We're not quite at quorum. 1, 2, 3,
No,
4,
let me
6.
check.
We need one more for quorum.
Yeah,
But as per the rules, I am beginning the live stream, so
sure thing.
be advised. We do have Ian. I see I have Madison here as well. I'm going to let her in. She'll be near the top of the agenda. And here's James. I think we're there actually. 1, 2,
Oh,
3.
good.
Yeah, we're good. So you can begin whenever you'd
Great.
like.
Okay, so let's call the meeting to order. And before we do move along, I just sent out an email to people saying, by the way, we've got a couple people missing today. They can't join us. And but I did send out an email saying we're going to amend the agenda for a new item for discussion. But the clerks have said we don't need to, and we can just discuss it under working group updates. So there you go, Angus. You will not need to, we won't need to look to amend the agenda. We'll just include it under the updates. And we can have an action item come out there if we need. So, can I get a confirmation of the agenda? Thank you, Jane. And thank you, Kathy and Jane, not Jane and Kathy. You jumped around.
I always mix us up. Yeah.
I never mix you up, but my screen flipped around.
We're both wearing blue. Yeah.
You're like twins in that blue. Actually, very nice blues. So we've got our mover and a seconder that the agenda for today's meeting of November 4th be confirmed. All in favor? Thank you. That carries. Any disclosures of pecuniary interest? I see no one with a personal stake in nothing. Thank you. Moving right along. Minutes. Can I get someone to put the minutes on the floor? Anyone? Bueller? Thank you, Jane. Thank you, Kathy. Did anyone have any comments on the minutes? Okay, I see no hands moving right along. All in favor? Thanks very much. Announcements. Does anyone have any announcements that they would like to share? No.
Counselor.
Oh, yeah. Go for
would
it.
this be the appropriate time to introduce Madison or save that for the
I think
presentation?
It's up to you. Go for it. Do it.
Okay. All right. Sure. Yeah. Hey, everyone. Thank you, as always, for having me. I'd like to take this moment to introduce my colleague, Madison Schuler, who will be helping me out with the presentation today. So Madison, I'll leave you to introduce yourself a little bit.
Wonderful. Thank you for having me today. As Ian mentioned, my name is Madison Schuler. I am a health promoter with the Community Health Promotion Team at Southeast Public Health. And again, I'm really happy to be here today and meet all of you, and I look forward to diving in shortly.
That's great. Thanks so much for coming today, and thank you for your work on. Are you one of the authors?
Yes, I am.
Yes. Okay. So it's so great to have you here. Thanks. And I look forward to hearing your presentation in a couple of minutes. And Lindsay stepped in. Hi, Lindsay. So any more announcements? No, I've got a couple. First, I guess number one, the zoning bylaw has provisionally passed. After it was the day after our last meeting, it provisionally passed. And there's going to be some housekeeping changes brought forward. And one of them I heard, I brought a motion forward during that meeting to talk about encouraging renewable energy. And it didn't go forward, but what I heard from the planners after the fact, one of them contacted me and said there was a difference between agricultural and rural lands, and rural lands were excluded from a permission for a certain level of solar generation, similar to what agricultural lands are allowed to do. And they're, as a matter of housekeeping, going to even things up. It was actually a mistake. So I just thought I would share that in case anyone watched that meeting, because it might have been confusing or disappointing why there was a permission granted for large acreages of agricultural lands versus rural lands that are currently used for agriculture. So that's just a bit nitpicky, but I thought it was of interest and fits in with our purview. Additionally, and we were talking about this before we went on film, there's been an announcement by the provincial government to consult about creating a central conservation authority. It looks like they're looking to consolidate conservation authorities. And we've got Lindsay in the room and we've got John in the room who sits on Quinte Conservation's board. If either of you want to flesh it out a little bit, it doesn't look good to me. It looks like bad news, but I think it's worth this committee's attention that we keep an eye on that. And I suspect that Janice or John will be bringing forward a motion at some point, solidarity with the local approach motion, but that will be a discussion for another day. I just thought I would bring it up so that people are notified and can be watching it.
Given the province is a minority funder of the conservation authorities, it strikes me they should stay the hell out of it.
Yeah, but it's their legislation that creates their capacity. So the Conservation Authority the legislation that created the Conservation Authority establishes the purview of the Conservation Authority. Again, John and Lindsay know more than I do, but it is an sort of an arm's length governmental organization.
So they have control, but they don't really fund it at all.
No.
Yeah.
Troubling to me, though, is conservation authorities have enormous land holdings in Ontario, which are at a time where we have a province that likes to get rid of public assets. We could be looking at some losses of protected lands, which I think is going to be frustrating, considering we've got Ian and Madison here to talk about climate change and health vulnerability. It all sort of ties in together that, the more that we need to protect more wild lands and keep our lands healthy. So that's it for my announcements. If anyone has any other announcements, if no one does, we'll move on. And okay, I think we look good to go. So we'll move on to presentations. And thank you again, Madison, for joining us today. We've got Ian and Madison, and they're going to give us the overview of the assessment.
Through you, Madam Chair, to Madison and Ian, do you want to share your screen or do you want me to put up the PowerPoint?
Yeah, Ben, if you don't mind, it may actually be easier if you share your screen, if
Sure.
that'd be possible. Thank you.
1 second.
Of course.
Wonderful.
Okay, can you see that?
Yes,
Yes.
thank you.
Yep.
Okay, so I'll just jump right into it. So, hi everyone. As you know me, I'm Ian. I'm a health promoter within the health promotion across the lifespan program area for Southeast Public Health. And I'm very fortunate to be joined by Madison today. who introduced herself earlier as another health promoter with Southeast Public Health. And again, we'd like to thank you for the opportunity for us to speak on the Southeast Public Health climate change and health vulnerability and adaptation assessment today, and just provide a high level overview of the report, the report and its findings. If you have any questions at any point, just please raise your hand or interrupt us in the event that we don't see the icon. But I guess just before we get in, Madison, any comments or anyone else?
Nope, I think you summed it up beautifully. Let's get into it.
Okay, cool. Next slide, please. Okay, so today we'll be touching upon what climate change is, how climate change impacts our health and well-being, as well as what a climate change health vulnerability and adaptation assessment is, as well as our methodology and findings. And then we'll finish with the recommendations and the next steps to emerge from the report. Next slide, please.
No worries. So I'm sure, as everyone here is aware, climate change is described as shifts in weather conditions such as temperature, precipitation, and wind over a long period of time. Now, I think it's worth noting that there is scientific consensus that climate change is caused by human activities such as the burning of fossil fuels and deforestation, which are releasing carbon dioxide into the environment and warming the planet. Health experts and climate scientists both agree that climate change is the greatest threat to public health and that these risks will continue to worsen should global temperatures continue to rise. Climate change is responsible for serious health risks, such as heat-related illness and deaths, injury, polluted air, unsafe food and water, cancers from sun exposure, and the spread of diseases carried by insects such as mosquitoes and ticks. Next slide.
All right, and so to continue along the same vein as Madison was describing, the World Health Organization states that climate change is directly contributing to humanitarian emergencies and that these hazards are growing in scale, frequency, and intensity. And so it's not uncommon for us to hear of these emergencies in today's news, with examples such as Hurricane Melissa right now, Canada's wildfire seasons reaching new records, and many more. And so to continue, the WHO says that by the year 2030, the direct damage costs to health globally will be estimated around $2 to $4 billion US. And furthermore, research indicates that about 3.6 billion people globally reside in high-risk areas to climate change hazards. Furthermore, between the years 2030 and 2050, we may even begin to see over 250,000 deaths annually due to climate-related hazards. And so, as Madison was saying earlier, I'm sure that and confident that we are all fully aware of how climate change can affect our health and well-being. However, it's stats like these, as well as the real-world examples that are ongoing right now that serve as an important reminder of how expansive the impact and significant the impact of climate change is globally. Next slide.
And so this is where our report comes in. And in Ontario, actually, public health units are asked by the Ministry of Health to assess how climate change affects health and identify who might be most at risk. So to do so, public health units may use a climate change and health vulnerability and adaptation assessment, which is a mouthful. So I'm just going to refer to it from now on as a CCHVAA, which is equally a mouthful. But we use CCHVAs to understand how to create or support policies and programs that protect communities from climate change impacts. The goal of this work was to better understand the roles and priorities for public health programming, collect and use local climate data to improve related public health programs, and to create practical adaptation and mitigation recommendations within public health scope. So it is important to note that this is an internally focused document, internally being towards public health. Many public health units in Ontario have already completed CCHBAAs for their region, and those reports actually helped inform the development of our CCHBAA. Other key documents used in completing this project include the Ministry of Health's Ontario Climate Change and Health Vulnerability and Adaptation Assessment Guidelines Technical Document and Workbook. Now, this report was created by a diverse team of Southeast Public Health staff representing various public health programs, and at the time was a collaborative effort between 3 legacy health units. Next slide, please.
All right. So what was our approach to our CCHBAA? Madison touched upon it briefly, but the first component was completing an environmental scan of the literature to learn more about climate change at a local level. This included internal staff surveys to better understand what climate initiatives and work was already underway across the legacy health agencies, a review of local climate data to understand climate change and its impact on our communities, a review of other CCHBAAs by other public health units across the province, and key informant interviews with local organizations to learn of local climate change adaptation efforts and impacts. From this, we then use the information collected to identify and comprehend the scope to which climate-related health hazards may be impacting community members and which populations are at the greatest risk of being impacted by climate change. And once we had this information, we distilled it into our report, which was completed in approximately April of 2025. And just some examples of some resources or data sets we were pulling from would be Air Quality Ontario, which has information on historical pollutant concentrations and air quality health indexes from Ontario air monitoring stations. We looked at past weather and climate data, so looking at temperature and humidex, population health data from Stats Canada, Ontario Cancer Profiles, Public Health Ontario, and many more. Next slide, please. Okay, so what were the key findings for the report? Well, overall, the data indicated that Canada, as well as our region, will experience more frequent, intense, and longer-lasting weather events, such as extreme heat, wildfires, air quality advisories, and floods. Additionally, by the end of the 21st century, it is expected that the Southeast Public Health region will experience a greater number of days with heat warning levels during the summer months, and fewer days at or below 0 degrees Celsius year-round. And so, as you can imagine, this scenario will have ecological, agricultural, economic, and social implications. And so as temperatures and our climates change over the years, we can expect the rate of serious health impacts to also rise in frequency. As mentioned earlier, this includes heat-related illnesses, worsening of chronic diseases or complications, a rise in emergency department visits due to climate hazards, and more. Next slide, please.
So looking at some other key findings specific to our region, exposure to Lyme disease and skin cancer are of great concern, as the number of new cases are much higher than the provincial average and are expected to continue rising with climate change. So just looking at this infographic here, when we see Ontario 24.7 per 100,000, this is an incidence rate. So it's representing 24.7 new cases of melanoma per 100,000 people in Ontario, whereas in our region, it's 41.3 new cases of melanoma per 100,000 people. And the same goes for Lyme disease right next to it. So obviously, those are key findings for us specific to our local region. And from our discussions with key informants, we learned that climate-related hazards are increasingly affecting service and program delivery. So some examples that we heard include tornadoes, heavy rainfall, and freezing conditions disrupting facility operations, altering road maintenance practices, and leading to more frequent school closures. We also learned that many community partners are actively engaged in initiatives to address climate change, from educating the public and youth about environmental stewardship and the impacts of climate change to advocating for the inclusion of climate considerations in internal decision-making and planning. Lastly, while everyone is vulnerable to the health risks associated with climate change, certain groups are disproportionately affected. Next slide, please.
Right. So continuing on that trend, and as described earlier, part of our CCHVAA was identifying populations who be most at risk of climate change and its health hazards. And so the reasons for why groups may be more vulnerable to climate change hazards than others is due to a range of factors that may include, say, a heightened exposure or susceptibility to climate hazards, or say a limited capacity to recover from climate-related damages. So for example, populations relying on well water, such as rural households, may be more vulnerable to changing rainfall patterns and extreme weather events such as floods, which threaten water security, access, availability, as well as the quality of safe drinking water in comparison to those that are not on a well water system. Another example may be how rising temperatures may affect Indigenous peoples' access to traditional practices, food sources, and spaces, which then may negatively impact their connection to the land, cultural identity, and holistic well-being. So to address these disparities, there's an emphasis in making sure that climate change strategies incorporate a health equity lens and ensure a deeper understanding of how these populations are being affected in comparison to the general population in regards to climate-related hazards and risks. So this may involve strengthening physical, social, mental, and economic supports to help bolster and strengthen these groups from the increasing impacts of climate change. Next slide, please.
Next steps. So Southeast Public Health will use the findings from the literature, data, staff survey, and key informant interviews to create a comprehensive action plan to integrate climate change strategies into public health programming. The action plan will have the following pillars at its core: assessing and monitoring population health, health promotion, and health protection. These pillars will serve as the foundation for Southeast Public Health's Climate Change Action Plan, which will include developing a climate change monitoring and evaluation plan, prioritizing health equity and local knowledge to inform climate action, strengthening community capacity and resiliency through education, knowledge sharing, and collaboration, and developing plans to identify when and how to respond to future climate change trends and risks. Next slide, please.
Okay, so in conclusion, climate change is a global issue that will progressively impact the health and wellness of the environment, and is also felt locally and will affect those who live, work, and play within the Southeast Public Health region. And so it's important that we prioritize adaptation and mitigation efforts in public health programs and services by working to build a system that anticipates, addresses, and mitigates the emerging risks and impact of climate change. And our intention is that this report will inform and support an adaptive and resilient public health system for the Southeast Public Health region. And that includes, and rather to do so, that includes collaborating with municipal partners such as yourselves to help inform municipal planning and policy work, emergency preparedness, and much more. Next slide, please. And so with that, we'd like to thank you for your attention and again, the opportunity to present the report and its findings to the Environmental Advisory Committee. It's incredibly important work, and it's climate change is being emphasized by the ministry through the new Ontario Public Health Standards, especially with an emphasis on ensuring that resiliency and climate adaptation efforts are focusing on, say, mental health, emergency preparedness, and more. And so with that, myself, Madison, and others are looking forward and motivated to, again, work with municipal groups such as yourselves and try and do the best we can to serve and protect from climate-related hazards.
Thank you. Pardon me, thank you. So that's there's a lot more in the summary that people can read if you haven't already. It was also on our last agenda, so probably everyone here is familiar. Some of the, well, before I start jawing on, let's look to the group to see if they've got questions or comments. Anyone? Jane, thank you.
I'm interested that, I think, first of all, it's great that you're doing this, and I'm so glad somebody's tracking the data, and we're going to be able to sort of measure in real time what is going on. One thing I'm aware of when Southeast Public Health is what it's Kingston, it's what was Hastings, and is it Loyalist? Is that I'm just sort of guessing from the acronyms.
It's LGL District Health Unit. They're part of the merge entity now. Leeds, Grenville, Lanark, I believe.
Okay.
Yeah.
Yeah.
Good guess.
Yeah. No, that's close. Yes.
So if I were to look at, I remember, for example, looking at a chart from Mark Boone a number of years ago, where when he was looking, Mark with Quinte Conservation was looking at water vulnerability, which is much worse in Prince Edward County than it was in other parts of the Quinte Conservation area. And of course, so that's one sort of unique thing to Prince Edward County. Another aspect is, of course, our demographics. When you talk about older people being more vulnerable, certainly we are something like multiples of the provincial average for people, 65 and older and the like. So when I look at those two, one question I've got is, given that you've been these three entities have been amalgamated together, are we going forward going to be able to see data that would be applied for Prince Edward County? Would you be able to pull out data that would be PEC specific down the road?
And so to my understanding is that would still remain in place. I don't believe we're going to kind of put like a general generalized statistics, I should say, to cover the breadth of the area. I do believe that information will still be specific and we'll still be receiving information from those bodies, like you were saying with Quinte Conservation, as it just wouldn't make sense if we were to say or extrapolate what Quinte is experiencing. Kingston must be experiencing that. Exactly. There may be similarities for sure, like with melanoma and Lyme disease and algae blooms. As mentioned in the report, there are similarities in that the incidence rate is higher for the area collectively, but there will still be some uniqueness to the different regions.
I'm thinking from the standpoint of, say, anything that the municipality is funding, for example, in the way of solutions. And I'm also on the board of the county foundation. And we're, as we assess people's various grant requests and trying to, there's always more requests than funding available. So data that is specific to the county, as we're trying to figure out whose grant do we make a priority, would be really helpful. But as I say, I'm really delighted that you guys are doing this. I think it's a terrific initiative. So
yeah, we're very excited about it too. And as I mentioned, just the fact that the Ontario Public Health Standards are now emphasizing climate change more and placing it higher within the priority list is a big indicator. I know there's, as Councillor McNaughton was describing earlier, there's some, how do I put it? The provincial government is kind of doing some things while the Ministry of Health is trying to push for other initiatives or has different approaches to climate change, we'll say. Yeah, there is still a tremendous effort within our agencies to work on that stuff. And yes, while we are kind of a larger unit now, we are still going to make a point to make sure that programs and services will still be tailored to the municipalities that the agencies reside within. Madison, anything to add to that?
No, I think you answered that great, Ian. Yeah, we certainly don't want to lose any specific context by amalgamating, but just want to obviously better serve all of these regions and kind of streamline services for all of these regions without losing that context.
But I was just thinking, as you're gathering data, as long as you're maintaining, for example, postal code as a sorting factor, that should be able to help identify, okay, what is sort of specific to the county versus, you know, an area. I must say those Lyme disease numbers, I kept looking at that chart about 3 times going, am I reading that correctly? So
Yeah,
that was
it's
quite alarming to
staggering.
me.
And so further to that, is the health unit, is there a provincial mandate to be evidence-based?
Yeah. Or
Yeah.
go ahead, Madison.
Okay, so because you pointed out the province and health units, public health sort of are working, maybe not always in concert fully. I think the working from a place of evidence is your strength.
Yes. Yeah, and sorry,
Absolutely.
I should clarify, just meaning I'm forgetting the name of the bill off the top of my head, but the most recent bill that was looking into the Ring of Fire, like you have, you know, that working there, but then the Ministry of Health kind of pushing for more climate change initiatives and priorities, I guess, in that sense. Yeah.
Which could also be a great job creator and generator of you know, potential billions of dollars. So that's interesting. So are there other people who would like to ask questions or have comments? Okay, seeing no hands, I have a couple.
Oh, there's Angus.
Oh, there we go, Angus.
Thank you. About 20 to 25 years ago, I was a member of the Canadian Public Health Association Steering Committee on Climate Change and Health. And the observation I have is we were pushing back then for improved data. And I really have to wonder, why has it taken over 2 decades for this sort of step to be taken? I really applaud what you're doing. I think it's going to give the municipalities in which you're getting the data some really good information for moving forward on, I'd say, more the adaptation than the mitigation side, because climate change mitigation, people are now talking about a 2-degree increase by 2030. That is going to have terrible impacts. So we've got to put far more into the adaptation, not leaving mitigation aside, because we've still got to do that, but we need far more in adaptation and recognizing what can be done for the different levels of society, whether it's socioeconomic, age-related, gender-related, all those have got to be addressed for adaptation.
That climate equity for priority populations that you guys refer to in your report. That's something that's come up for discussion in this group before. If people will recall we've discussed and for 2 years sent to staff the potential to have, for example, an extreme heat management program for individuals as part of an adaptation application, if we ever go forward with one, to the Green Municipal Fund, which we're hoping to this year or early next year. And I don't think, I think that's still a smart, viable idea as we look at more people becoming vulnerable. This I find I'm curious about, like, there's a lot in here that talks about risks to each of us personally. I have lung disorders, a collection of them actually. Woo. So like even thinking about things like being able for people who are impacted is public. It's never been the role of public health to be able to ensure that they can receive the medications that they need, that we still don't have a provincial pharmacare program. We've got the Trillium program. Is there anything that municipalities can do in this realm where we've got more unprotected people who might be vulnerable, who will become potentially sicker? Is there anything that we can do in that regard? Is there, from an advocacy perspective or from a practical perspective, is there anything that municipalities should be thinking of regarding? I mean, I still think, I'm hoping that we'll be able to figure out how to go forward with that heat pump loan program or something like that for extreme heat for renters. But is there anything that any place where a municipality can add support or lay the groundwork or be working with the health unit to be able to remove barriers or move things along that you're aware of?
Yeah. Do you want me to jab at it, Madison, or yourself?
Go
Or-
ahead again, and I'll build off of.
Okay, sure. Yeah. Well, it's a great question and also I'd say a tricky question at the same time. But I think you kind of touched upon it, Counselor, in terms of, say, like the advocacy bit or even just the notion of having the discussions now. I think an important thing that was touched upon in the report is the collaboration with municipal partners, and within that, going through the education piece. I don't know if there's something, maybe Madison can correct me. I don't know if there's too much we can do in terms of connecting individuals with healthcare providers directly. But what we can do is, at least through education and messaging, raise awareness of those notions, especially come, say, like wildfire seasons, and just thinking of, say, like asthma,
Right.
as well as allergies as well with pollen. There may be just like we could bolster our again, our messaging, our education within municipalities to raise awareness that these are growing concerns that should be addressed, and it would be worthwhile speaking with, say, your general physician, family doctor, or whomever else for that. Madison?
Yeah, what immediately came to mind again was this health equity lens that you, Councillor McNaughton. I was so glad to hear that these discussions are already happening. Oftentimes, I don't think that's necessarily the case all the time. So always bringing in that health equity lens into climate conversations and conversations with groups and municipalities. The same way we don't want to lose context for, specific local issues. I don't think we want to lose context when it comes to different things that different people, how different people are vulnerable to climate change. That context is important. So what immediately came to mind again is just continuing to have those conversations, continuing to bring that lens into climate. Although we can't connect people with direct services, we're always happy to review again municipal plans, or even come and do these presentations and be part of these tables to continue to move things forward however we can.
Even amplifying some of the public health messaging.
Yes.
I presume it's really easy to be connecting with our communications team.
Yeah.
and pass along important messages during wildfire season that need to be passed along. Like, if
Absolutely.
you're having trouble breathing, here's what you need to do.
Mhm.
That sort of thing.
Yeah, and if I can also just quickly add to the communication bit, along that same vein is like communicating or partnering with school boards and providing
Yeah.
that messaging,
Yeah.
be it for again like Lyme disease or wildfires, asthma, pollen, and many other climate related hazards. That's something we can do. And I believe for the most part, messaging for those things does come from the Ministry of Education, but public health does still have a role in there, I believe.
Mhm. And education, the education piece with communication
Mhm.
as well, and just leveraging
Yeah.
each other's like resources and your reach with education and our reach with education. Sometimes I've had conversations with others who don't necessarily know that heat pumps both heat and cool, right? Because it's called a
Right.
heat pump. So things like that.
The rebranding, yeah.
Should be called that,
Yeah,
yeah.
right.
Yeah.
Yeah.
It should be called a comfort temperature pump. Or
Yeah.
something.
There you go.
Okay, this is as we go forward, I think helpful information. I do have one last question, which is
Mhm.
I can't remember. It was somewhere in the report that you struggled, that you that due to sort of there was a gap in your consultations with local First Nations partners. Is there a plan to sort of try to fill that gap to make sure that you're understanding what the couple of communities in your catchment, whether they have any particular vulnerabilities or experiences or information to share? Is that something that you have a plan to go forward to collect?
Mhm. Madison, you are me.
I either or. Yes, Councillor McNaughton, that's absolutely part of the plan. Although there is not a specific definitive outlined plan in place, that is definitely part of the action plan, is to reach out, is to learn more. And this time, maybe because again, before we did key informant interviews, and it was a very specific way of reaching out to partners and things. And I think this time it's a matter of learning what the most effective way will be to create those partnerships, create those connections. It might not necessarily be a key informant interview.
Right.
So it's learning about how best to build those relationships, how best to listen, and so while that is absolutely part of the direction we're going to take with the action plan, to answer your question, there's no specific outlined approach currently. But now that we are one health, all these regions,
Right. Yeah, everyone's drawn together.
we now, yes, can have kind of those conversations and look forward to it. Go ahead, Ian.
Yeah, and I'll just add that like although we've completed the report, that's not kind of the end of any type of partner engagement or learning. This is just kind of a big milestone or a stepping stone. And as the report and a presentation indicates that we are looking to continue with monitoring, with evaluation, consulting with municipal partners such as yourselves. If there are groups that perhaps we may have missed in the past, as you all know, climate change is it's a long game. It's a continued effort by everyone. And so we're going to continue having those conversations to make sure we're implementing down the line a climate action plan that will support our community members across all the regions.
So Megan, you've got your hand up. Jump in.
Yeah, sorry, I just thought I'd jump in again.
Thank
Apologize
you. Yeah.
for my voice. My name is Megan. I'm the environmental supervisor with Mohawks of the Bay of Quinte. Just based on the conversation, I'd be happy to be reached out to. Kate has all my information. I know my emails on the threads for these meetings. I can be difficult to get a hold of because I've got far too many things on the go, but a call is always great. So I'm happy to share my number with either of you, and we've definitely have a general interest. Thank you very much for the presentation and the information. And I have some kind of cool things going on that I think could link to this. So yeah, happy to communicate with you guys.
Megan, if you ever want to present the cool things that are connected to this to the group, I'm sure we would love to hear about that too. Because if there's any way we can support, or if there's any way that we can steal good ideas, we're up for both. I think generally, or at least to try to steal good ideas. As it doesn't always work, but theft is my municipal favorite. So any further comments, any further questions? Okay, I think, yeah. And Madison and Ian and Megan, if you all want to be connected offline, you kind of already are, but I can make the formal connection if you want. But otherwise, let me just flip back to my agenda. Thanks so much. We've been sort of waiting prior to its publication in this late spring, if memory serves. We'd heard about this, I guess, about a year and a half prior, and it's really great to see it and really helpful to know that we're all sort of steering our ships in the same direction, at least as much as, hopefully more and more all the time. I should say yacht, because Angus is in the room. We're all steering our yachts in the same direction, our wind-powered vessels. So thanks very much. And I need a mover and a seconder to receive the presentation by Ian and Madison regarding the health units, climate change and health vulnerability and adaptation assessment. John and Angus, and thanks so much. All in favor? Great, thank you. That carries. And I hope as things progress that you reach out to us anytime you want, or anytime we can be of help in any way, and we can connect to offline to put you together with our communication staff if you're not already connected with them. Thanks.
Sounds great.
Thank you so much.
Thank you both.
Welcome to stick around, or you're welcome to actually, go and have a real life, because your workday is probably over. Thanks, Madison. Take care. And thank you very much, Ian. So did we say all in favor, Ben?
Yep.
We did. There are no comments from the audience listed. Items for consideration, we're going to move straight on into 8.1, which is a follow-up item from a prior conversation. We talked, I don't remember what month we talked about it. We talked about the food bill and decided to take our cues from the agricultural community, and you have attached the motion that they carried to refer forward to refer to council for adoption. And that's a result of those early conversations that we had regarding the food belt bill. And we had I think we had those conversations in June. They got reported on in July. Mike Schreiner came in August to talk to members of our farm community, and Ben and myself were lucky to be in that meeting. Or was it Becky? I can't remember. My gosh, my memory is absolutely terrible. And this is the fruits of their conversation, so that people can just see where it went. And if we would like to add a recommendation that council adopts it, we could consider that, or we could just leave it as is. I think it's an easy, I think it'll sail through council. I can't fathom anyone having a problem with that, but you never know. Yeah, John.
Don't be so sure, Madam Chair.
I mean, famous last words, right?
This is you have to remember, this is not a government bill. This is a private member's bill brought by the Green Party.
Oh, no, I meant with our council supporting it.
Yeah, I know.
I have.
I know.
Oh,
I know.
okay.
I'm aware. But the
Yeah.
key thing that many members, some members of our council will object to, is this requirement for agricultural impact assessments on certain lands. And I guess there's nobody here to explain what's before us here today. But in the bill, it says that if zoning change is proposed, I'm just paraphrasing, for the word used is prescribed land zoned for prescribed agricultural uses.
Yeah.
Do we know what prescribed agricultural uses are? That's going to be the question before council. Is that our prime ag land? Is that any kind of ag land?
Oh, but they have not actually worked that out completely yet.
Okay.
You say in that
The
case,
bill authors were trying to leave it as general as possible, so that it would be the actual experts at the table. The round table part of the bill is to appoint the
Right.
table, and they would prescribe what that actually means. It's too bad we couldn't sort of all be at that meeting. It was really quite good. He was
So I just to say, I think that may be a sticking point, certainly going to be a sticking point with the Conservative government in Toronto, that we
yeah.
impose yet again another study has to be done when changes are proposed to certain types of farmland, and we don't know what types those are yet. So
Mhm.
you can picture the argument that's going to happen in council. But anyway, I just wanted to say that.
Well, and you can picture the argument, the way it's going to go at committee in Ottawa or in Toronto as well.
Yeah.
I don't know. I don't see it having a problem at council. I think this is something that our council would support, but like you said, you never know. Don't be so sure. Does anyone else have any comment or question? Does anyone feel inclined to put on a support motion or any sort of right? I don't.
But this motion is coming out of the Agricultural Advisory Committee?
It is. They've already approved it and sent it. They're sending it to council on the next agenda, I believe, on the 10th, where council will decide to adopt it, or I guess potentially not.
I think it sends a message if both committees are recommending this jointly.
I certainly, I mean, I think they know the agricultural advice. I agree. I don't think it's necessary, but I think it would be nice. And I think it's good to support their committee.
Yeah.
Just generally.
Well, people love to sort of set up the straw man theory of setting one against the other. So I think it would be useful to say, no, this is both.
We're all on the same team.
Yeah.
It's important. So if you are thinking about moving that, I think, Ben, would it be something as simple as
I would propose something like that the Environmental Advisory Committee endorses the motion passed by the Agriculture Advisory Committee at their October 27, 2025 meeting regarding support for Bill 21, Protect Our Food Act.
Yep.
That's perfect. I think, but
that works.
I wouldn't be moving it. Okay, what do people think of that? Jane, did you want to move that? Does someone want to second it? Is there any discussion? Do people want to discuss? I see nothing. Zero.
I'm sorry, did somebody second that?
Yeah, I think Kathy.
Oh, thank you, Kathy.
3. Okay. Any further discussion or no? Okay, Ben, that's a lovely motion. Thank you.
No problem.
All in favor? Okay, and that carries. So, thank you. I think that is, it was very nice to see that coming forward. Okay, moving right along, item 8.2. So, this was, we included this just to bring up the, it hasn't quite solidified yet, but we did have a little bit of movement at council where John had the good sense and some success at discussing how we could potentially fund a project at Wellington Beach, talking about preserving the that it's been sort of hit by climate change, by unpredictable weather events a couple of times and is at risk. And there's some there are some varying plans to improve that area and protect it in perpetuity. There is the potential to, and it allowed us to kind of sock away a little bit of money to be considered at budget to be able to potentially move forward with that plan to shore up that area with some municipal funds sort of earmarked. And this builds on our discussion from last month, which is without earmarked funds, how do we move forward with anything this year? So John and I should actually let John just jump in right here and talk about his discussions with Adam and how that went, because he's going to be far more eloquent than I will be, and he actually knows the backstory.
Yeah,
So,
thank you, Madam Chair. This was a victory in that this is the first time that we've actually gotten a climate adaptation grant project through council. Now, like you said, Madam Chair, it's not done because once we get to the budget discussions, this and any other item, of course, can get abandoned. But I thought that our ability to answer the questions from the usual naysayers worked out pretty well. So it should be possible to happen. And the reason, just so everyone understands how this works, this is to have access to FCM adaptation grant money, of which there is hundreds of millions of dollars available. And we would hope that aspects of the Wellington Beach project, which are definitely related to climate, like changing the grade and rebuilding the road upwards and putting a berm in place so that wave uprush as happened in 2017 and 2019, doesn't destroy the place again. To the tune of possibly $500,000 could be covered by an FCM grant.
Right.
But the county has to prove in making that application that it has its share of the funds, which in this case would likely be 30%. So that has to get into the budget. That it's one of those if this happens, then that happens kind of budget items. And I know Albert Peskoviak has been scrambling around to find some internal money already, but there will still be an ask at budget. And the way I worded the motion, which went through actually, even under questioning, was that we could add other projects other than Wellington Beach to this ask. So I've got Albert looking at what else on the famous huge spreadsheet of climate projects might get added onto this. And we'll see how much of it flies at council. I mean,
there's also the additional sort of inducement if your projects, if projects in your application fulfill certain obligations or certain categories on the list, like sort of providing climate equity, for example, going back to our discussion with public health, or if they connect to an indigenous community, or then you actually Lindsay, it's the Adaptation and Action Grant, I believe. But there are a couple of adaptation grants.
Yeah, and you can get another 10% for those things. Yeah.
Yeah, and so if there's so having had some preliminary conversations with the foundation, they might be interested. They're going to talk to their board. Jane, I believe, has had preliminary conversations with their staff, and I've just had a conversation with their acting executive director who's really interested in looking at what they can do too, and maybe we can combine efforts and maximize those dollars, which I think would be really potentially exciting to be able to see if there's a way that we can support some like partner on projects that might increase our points.
So if you, I'll just finish by saying, so if you all are contacting your counselor, whoever he or she may be, in terms of things to happen in the budget, please let them know that you fully support this FCM grant proposal.
Yeah, it would be great to get some dollars for exactly that. That's very good. Thank you, John. You did a great job at council. That was really quite good, and I thought Albert did a good job at sort of isolating what the problem with this area was and what some of the opportunities are. So congrats.
Absolutely.
Okay, so there's no action required. It's just receiving the discussion. If people do want to float brilliant ideas at this time, we already have lists of ideas, but if you guys want to, you always can. Otherwise, we'll get this on the floor. Can I get a mover and a seconder? Thanks very much. I can't see. My screen is flickering. John, thanks. Jane or Kathy. John and Kathy seconding. Thank you. So all in favor, any last comment, or are we good? Okay. So that was pretty much just an update too. All in favor. Thanks very much. That carries. So that brings us to working group updates. And I'm going to, before we go to Angus, because Angus has one that's probably going to involve an action item, I'm going to throw this over. Kathy, do you want to give a couple of, just a brief update? Or you don't have to, putting you on the spot.
Oh, you're on mute, Kathy.
Sorry.
Oh,
you're back on mute.
Oh,
there we go. Gotcha.
Nope.
Muted. Gotcha.
You hear me now?
Yes.
Oh gosh. Okay. I'll be real quick. And Madam Chair, I have to apologize. I have not had a chance to get in touch with Mark Kerr about what we talked about.
Don't apologize.
Our communications. But yes, we held one brief working group meeting, very shorthanded. There was only a couple of us and Kate, but we'll be holding another meeting in November to put in place. I've been madly making notes as we've been talking here, because there's some things that I see us promoting through the education and outreach. So I'm sure our next meeting is going to be chock full of information to share at our next EAC meeting. That's what I've got so far.
Thank you, Kathy. That's great. I would also suggest we still have lots of room in that group for more members. So if you do have people who you think would be great for education or outreach, or if there are people in working groups that would like to add to their busy schedules, we'll take them. So, and that could, and I think, at one point there were a couple of people in the natural cover working group who were interested. And I'm not sure if they still might be. So they would certainly be welcome. So if people want to let people in their working groups know, we'd be obliged, and we would love to have more hands to share the load. I don't think it's as exciting on principle as the Climate Action Plan working group. or the Natural Cover Working Group. I think those are where people's hearts really are, but this is something that is could be potentially really exciting too. So then I'm going to throw it over to Angus and I think John, but take it away. Take it away, either of you.
I'll do
John,
planning if you like, and
planning.
then we'll get to
Yeah,
Angus.
sure.
So Angus and I worked on comments on the first proposal that's been put in for what is called Hillside, and that is the property. If you picture where Base 31 is, and coming down the hill to on 22 to County Road 10, it's the land in between, which is mostly kind of wooded. It contains Marsh Creek and a piece of a small piece of farmland. Anyway, Alan Hirschfield has proposed a 400 some unit subdivision there with some affordable housing context. So Angus and I commented on a whole bunch of the studies that they did and submitted, and the planning has accepted our comments with gratitude, and we'll see what happens.
Thank you.
But I see, Ben, this isn't on our agenda for EAC to endorse our comments, right?
Oops.
Too late?
Ben, can you put it on the mic? Or can you turn on your mic?
Pardon me, through the chair to the council. It was a matter of timing, just the agenda timing. But they'll be on the next agenda just for the endorsement of the committee.
Yeah, no rush, so that should be fine.
Thank you. Megan, you've got your hand up.
Yeah, I was just wondering if John could re-describe the location. A little less.
Well, if you picture where County Road 1 or Sandy Hook Road runs into County Road 10, and then you could turn left to go down Lake Street into Picton, or you turn right to go out towards Cherry Valley. It's that property straight ahead of you with a bit of a hillside. Just
perfect.
Base 31, yeah.
Okay, thank you, John. Appreciate it.
Yeah, it's literally like south of town, 1 kilometer. I think, is it included in our secondary plan, John?
It sure is, yeah. It's part of the built-up area, so.
Yeah. Oh, Megan, do you know if you guys were consulted yet?
I will have to look.
You don't need to.
Should have been on the circulation, I would think.
I would imagine.
I would imagine also. I just have to touch base with our consultation coordinator. She does all the filtering of everything. So
right. I can't remember, what's her name?
Cassie Thompson.
Cassie, thank you. Thank you, John. Now, Climate Action Plan Working Group also has an update and potential action item.
Okay. I actually gave the members of the Climate Action Plan Working Group most of the summer off. We'd done nearly all of the background work, and what we have now is really sufficient data that we can put it together and let council know what has happened. So what I would like to do is to get approval from the group, and we'll come up with a motion in due course for Don Wilford, who's vice chair of the Climate Action Working Group, and myself to do a presentation to council and outline to them what we found in the way of community greenhouse gas emissions, what we can I'm not sure I'll say look forward to, but what we can address going forward when we're seeing the potential for a very large number of residential units in the county, the impact they would have if they were all or majority gas heated, and using air conditioners instead of using heating and cooling pumps in the winter and summer. So we're putting the numbers together for that. I'm meeting with Don next week. We're going to draw up the report that we will give to council, and my preference would be that it would be a presentation and not a deputation, because then we are not limited to 5 minutes. We can get a little bit extra time, which I think would be very useful. And what we really want to do is to bring forward to council the absolute urgency of both climate mitigation and adaptation that we can do in the county. So we'll be putting that forward. And what we will do, we'll come up with the report pretty quickly, and we will send it to the members of this committee for information. If you feel there's something that absolutely should be in there, get back to us quickly and we can make changes.
Have you circulated that, Angus?
No, it's not done yet.
Oh, okay.
We're meeting next week to go through. We're going to use the assistance of AI to develop the report, and apparently it's much better when you put in what you want it to include in there than when you ask it a question and say, what happens if? So you can actually trust it a lot more. So we'll be working on that. I'm hoping that we'll have it by the end of next week, and then we'll get it out to you so that it can be presented either to council or to committee of the whole in November prior to budget.
Is this something that you're hoping could sort of provide a guidepost while we wait for the formal climate action plan to actually get finalized and before council? Is this something that could function in that way?
It can assist in it, but it's you've got to remember we are only doing community. So corporate is on their own.
Right.
But we will marry the two together.
Okay.
So I would like to put forward a motion, and Ben, you can tidy this up, that the Environmental Advisory Committee approve the delivering of an update by
presentation. Don't forget presentation.
A presentation by Angus Ross and Don Wilford to an upcoming council or committee of the whole meeting on the community aspects of greenhouse gas emission reduction and adaptation.
One moment.
And no, I did not have it written down.
Okay, I have it written down. I had a slightly different version. If you'll allow me, let me just read this.
Yeah.
That the Environmental Advisory Committee approves Angus Ross and Don Wilford making a presentation on behalf of the Climate Action Plan Working Group regarding community greenhouse gas emissions reduction and adaptation at the earliest feasible council or committee of the whole meeting.
Thank you.
You can live with that?
Yep. Yeah.
Okay.
Better than mine.
I think having that come in November, Ben, is that something that is
feasible?
It is feasible. We had a quick discussion here in the clerk's office that
Good. Okay.
whether it's committee of the whole or council, it's frankly more likely committee of the whole,
Great.
just given the volume of business to be handled this month.
Yeah.
But Angus and I can discuss this offline,
Right.
kind of what date would be convenient. But if that's okay. So is that Angus?
Committee to me is a great place because you get a bit more ease of discussion. I think that would be honestly
A good approach.
And we discussed a presentation is probably the way to go, as you suggest.
Thank you.
So I have that as moved by Angus.
Seconded. I'm happy to second that. Ben.
Okay. You're good
Okay.
to go, Ben?
Yeah.
All in favor?
Back to you.
Further discussion, or are we good? Okay, all in favor? That carries. Thank you, everybody.
Thank you.
And thank you, Angus, and please extend your thanks to your working group, because I
Yeah.
think that's good news that you've got all the data that you require to move forward, and that that we can sort of look at and that we can hear that before we go into our planning for next year at budget.
Great.
Thanks. Moving right along, April, and I'm cognizant of time, so we'll try to move ahead a little quick. 8.4 work plan. So Kathy has reached out to me and she's got, I think, an item that she would like to discuss, including in the work plan or
Madam
add-
Chair, sorry, Madam Chair,
Yeah?
I'm just going to pause you there. We just need a quick motion to receive the other updates from the working groups.
Oh, yes, of course, that the updates from the working group be received. We should have rolled it in with the motion. John, thank you very much. And Jane, thank you very much. All in favor? Thank you. Thanks, everyone. That carries. Okay, back to work plan. Kathy, did you want to bring that up now, or is that something that you're comfortable bringing up now?
Through you, Madam Chair, I had, and at your suggestion, I mentioned to Ben, if that could be added to the work plan, is along with the shoreline protection, was create a, the county currently doesn't have a bylaw protection of wetlands, and I'd like that added to the work plan, was wetland protection in the county.
Okay, so did you do? I feel like a while ago you did a scan on what could be done. Is that something that
that was a long time ago.
Okay,
There's been a lot more data that's been collected
Great.
by various stakeholders, and I'm happy to do another presentation at some point in the future. And I know Quinte Conservation, Sarah, and I'm sorry, I can't remember the other chap's name. They did a presentation as well.
yeah. Okay, so we can. I think is to
All
put
we
it
needed,
plan
all we
to
need
be-
is a motion, just
Okay.
Yep.
it is best with a motion that wetland protection be added to the committee's work plan.
Okay, well, you got a seconder. Jane's got her hand up. So, and I presume it's to second, not to. Yeah. Okay.
I assume Kathy was moving. Yeah.
I absolutely. So, any further discussion or any further or any questions? Seeing none, all in favor? Great. Okay, that was easy. So we'll try and get that moving. Maybe Kathy, we can talk about how and when in the next week or so that we know for when it will come forward over the winter.
Yep.
Where we're not quite at yet, but getting there. So the other thing we're seeing, we've got on the agenda air rights for solar panel installations at municipal parking lots. So this is something that came up recently with the zoning bylaw conversation. there's a certain degree of rights for zones, for agricultural zones to have a certain amount of kilowattage on agricultural lands. But honestly, those agricultural lands, there are multiple uses for those, but there is nothing for air over parking lots. And I started thinking, do we need to be looking at whether there's a financial and an environmental benefit to seeing if there are some leasing opportunities? And I don't even know how to begin that type of work, but I think it's interesting and would like to maybe put in a bit of time on it. And potentially we could also be looking to see what is in the zoning bylaw. There was no permission necessarily for parking lots of a certain size like France has done. France has a law now requiring parking lots of a certain size to have solar panels over them.
Yeah.
But what we don't even have is permission. So it would have been good to sort of get that sort of sorted out long before the zoning bylaw came forward. But there is the opportunity with the housekeeping. They'll be bringing forward, planning staff will be bringing forward a housekeeping motion that's going to even out things between rural and agricultural lands that touch on solar. Perhaps there's an opportunity to just open permission for parking lots.
I mean, that would seem crazy. I mean, if I can put solar panels on my house in
Yeah,
a residential, in an R1 area, I can't imagine why we can't have
I
that.
don't know. It might not need a rezoning. So if you're
Okay.
if you've got like a parking lot like Foodland, and you want to put up solar panels, maybe you already can. It's not certainly explicitly listed
Mhm.
in the parameters for parking or for commercial areas, but it might not be excluded. So I think that's an interesting conversation to have. I just want to know if the committee wants, if this is something the committee is interested in, and in which case we'd add it to the work plan. I'm certainly happy to do some exploration on it and then report back if the committee is interested.
Yeah, this is occurring all over the world. I see a constant stream of examples coming at me over from like Instagram
Yeah.
engineering sites. So
Well, France was the biggie. Was it France or Paris? I can't remember. Anyway, I put it to the committee. I can't move anything because I'm the chair. But if
Move
that's
it.
okay. If you have is there a seconder? Angus? Okay. Any concerns or questions? And I can't see half of my screen because it's
I don't
flipping.
see any hands up.
Okay,
Yeah.
very good. Okay, all in favor? And I can't, I'm sorry, did anyone get a body count? There we go.
Oh,
That carries. Okay, thanks very much, everyone. I will report back at a future meeting. And the schedule of meetings.
Sorry, we just need a motion to just
Of course.
receive
The
the
work-
discussion in general.
Any further questions or additions, subtractions, or alterations to the work plan? Okay. I see none. Can I get a mover and a seconder? Thanks, Kathy. Thanks, Jane. All in favor? That carries. Thanks very much. So the meeting schedule. So anyone who's not in the know, you are now. We post our entire meeting schedule every year at this time. There you will see there are changes proposed for all of the committees because it's an election year. So and it's the last meeting that is proposed by clerks for the Environmental Advisory Committee is proposed for July 7th. But we can have more at the call of the chair as necessary. And I think it's going to be sort of what we did last term, and that we're 7 months 8 months before we need to be talking about this, but last term we had a meeting at the end of the summer or very, very early fall. I think it was September, to create a note to file to provide to the next committee meeting, which actually was something of a linchpin for our initial planning exercise that we did at the very beginning of this term.
The development of the work plan. Yeah.
Yeah. So I think keeping that in mind as we move forward over this next 8, 9, 10 months, I think having that opportunity down the road is something that we can schedule as we get further along. If anyone has any issues with this schedule as is, it's pretty much our standard schedule, and the days flip around a couple of times, just like they have in the past couple of months, depending on where council meetings sit. So we've got a couple of dates where we're the second Tuesday of the month, not the first. Anyway, I just thought I would draw your attention to that. Otherwise, when's the next meeting?
December 16th.
Yikes. I have to get back to my agenda. December 16th. And does that work for everybody? I don't hear any.
I'll be in my festive Santa Claus tie.
Perfect. Oh, I was going to say suit, and that was going to be much better. And I will do my very best to provide Ben a Santa suit. I promise not to, Ben. I am.
So then just a motion
okay.
to receive that.
Thank you. Can we get a mover and a seconder to receive the schedule of meetings? Thanks, John, and thank you, Angus. All in favor? Great, thanks. And adjournment. Next meeting date we've already covered. Can I get, and Megan, your thumbs up. Can I get you to move the adjournment?
Yes, absolutely.
Okay, so mover and a seconder. We've got Megan moving and Kathy seconding. That this meeting now adjourn at 5:28. All in favor? Thanks very much, everybody. That carries. And thank you, everyone, for coming out tonight. Have a lovely evening. And thanks for all of your thoughtful questions, comments, and actions. And Angus will look forward to seeing that report. That's awesome.
And Angus, I will be in touch with you about scheduling. All right, good night.